Good afternoon, respected judges and the audience. Today I'll be presenting our research work on evaluation of OCT angiography changes in cases of NAION. My co-authors are Dr. Sumant Sharma, Dr. Rohan Chawla, Dr. Amar Pujari, and Dr. Rohit Saxena. We have no financial disclosure regarding the study. So as we all know, NAION is a common optic neuropathy above the age of 50 years and occurs as a result of decreased perfusion pressure in posterior ciliary artery, which leads to optic nerve head ischemia and thus edema. Modalities like fluorescein angiography and ICGA have been tried to delineate the microvascular plexus in these patients but have been unsuccessful. OCTA is a non-invasive modality which can delineate the microvascular plexus at different level. Multiple studies have shown that the peripapillary vascular loss on OCTA in NAION patient when compared to control-ized papillitis and papilledema. It may be interesting to explore the role of NAION on the microvascular structure at the level of macula. Also, to understand the natural history of NAION, the longitudinal changes have to be evaluated. So the aim of this particular study was to evaluate the longitudinal microvascular changes at disc and macula over a course of 6 months in patients of NAION, where this was a prospective longitudinal study where we included 15 patients of NAION who presented to us within 6 weeks of onset of symptoms and 15 age-matched control. All other causes of ocular pathology which may affect the retinal vasculature directly or indirectly were excluded from the study. All patients, after obtaining the informed consent, underwent detailed examination including contrast, color, fields, and OCTA. We used a swab source OCT by Topcon where we use 4.5 by 4.5 mm protocol for delineating the optic disc and macula at different level, at superficial level, at radial peripapillary level, at choriocopullary levels, and at macula at superficial capillary plexus, at deep capillary plexus, and choriocapillary plexus. So these are just images to show how vasculature looks at different levels, at the level of disc and at the level of macula. To quantitatively measure the vascular index, we use the ImageJ software, where we imported the OCTA image in the ImageJ software, converted it to an 8-bit image, then used an auto threshold program with minimum thresholding to delineate the major vessels. The same image was again reopened in a different window where we used local thresholding using Fancelker algorithm to delineate the microvasculature. So then we measured the number of pixels in the histogram for each of them separately. So to delineate the microvascular, we first took the total pixels, subtracted the major vessels from the total, and got the microvascular pixels. Then we divided it with the total pixels in the image to get the vascularity index. This was done at each level for each image at both disc and macula. To coming to the results, the mean time of presentation of symptoms was around 4 weeks, and almost 12 patients had some or the other systemic issues, and the visual acuity was very much severely affected. To compare it with the control, all the parameters at disc and macula at different levels showed significant reduction in the vascularity index as compared to the control eyes. The OCT parameters at the disc shows progressive decrease in all the indices except the choriocapillaries, which was more or less stable. So this was suggestive of a reduction in vascularity, likely due to the reduced metabolic demand due to the secondary atrophy of optic ganglion cells. At the macular level, all the parameters were kind of reduced, but they were more or less stable at the period of 3 months and also at the 6 months. When we correlated this with the visual function, we found that the visual acuity and the contrast sensitivity correlates positively with the vascular indices at the disc but not at the macula. So to conclude, I would like to summarize, I would like to say that the peripapillary mascular densities at all levels, at the superficial, mid, and choriocapillary levels, were decreased when compared to control group, which is similar to what was found by the various researchers. And this continuous decrease represents the reduced demand due to the loss of RNFL. Superficial macular vasculature showed reduction at presentation, however remained stable, which is similar to that what has been reported by FARD and Tao et al. In their studies. These two researchers did not report any change in deep macular vasculature. However, in our study, just like Osterberger et al., we also found that the deep macular vasculature was affected, which may be suggestive of concurrent retinal ischemia secondary to the disc edema that causes vascular compression leading to further ischemia. Conclusion, OCT may be a useful tool to delineate the microvascular structure of retina and helps in understanding the natural history of NAIN. However, no study is without its limitation, and our study is limited by its small sample size, and I cannot rule out the segmental errors that may have occurred due to the presence of severe edema at the presentation. These are my references. Thank you.
So I think what was the age group, mean age of all these patients that you...
Sir, around 55 years or so.
And did you do ESR in all these patients?
Yes,
CRT?
to rule out, yes. We included patients of NAN only when we rule out the arthritic causes and the inflammatory causes.
Because that'll have a major bearing on what
Yes.
goes. And how did it compare? I know LVPI group had done a similar, they have published...
Yes, sir. From Dr. Gandhi et al., their group have published a similar study. They actually looked at the pattern of the vascularity index, at the loss of the vasculature, but did not calculate the vascularity index. So it was more of a qualitative analysis than a quantitative analysis, while we did a quantitative analysis.
All right, thank you.
Thank you.
One more question. Any difference in the group where you found that there was concurrent retinal ischemia along with the superficial vascular changes? Visual acuity wise, did they have any difference at 6 months?
Do you mean the visuals? Ma'am, the problem is that we had only 15 patients and only 1 or 2 patients showed some kind of improvement. So it was really difficult for us to compare the two groups. But yes, if we include more patients, in fact, that was one of the aim to find out from this study. But if we include more patients, maybe we'll be more enlightened.